and we are now live here with another Courage session. Thank you very much for joining us today. My name is Enrique Halso. I am the Associate Director of the Texas Health Education Service, and we're so glad to have you joining us today. We know that this has been a very difficult year in trying to figure out the pathway for pre-health students, with COVID affecting so many different aspects of our lives, the preparation for pre-medical, pre-dental, pre-veterinary students has been altered significantly. And we are so pleased to be able to have Dr. Karen Delivares joining us today. She is quite the expert, a great friend and mentor and colleague. And I'm so happy that you all get the opportunity to talk to her today. So, Dr. Delivares, would you mind introducing yourself?
Good morning, good afternoon, depends on where one is in the United States at this point. And I'm very happy to have been honored to have been asked to do this. I recently retired from being the director at the University of Texas at Dallas Health Professions Advising Center. I also had the privilege of teaching class there. I'm still on as an affiliate faculty member with the Center for Values in Medicine, Science, and Technology, and I do some NAP volunteer advisor service kinds of communications.
Would you
So
mind
I'm
sharing a little? Sorry to cut you off, but I know that volunteer advisor service through NAP is very important work. Would you mind sharing a little bit about that and what it looks like on your end?
well. We have a great person who coordinates for all of us across the United States, Dr. Rob Cannon, and students connect, or anyone who is interested in pre-health advising connects through the NAP website, the National Association of Advisors for the Health Professions. It's nap.org. And then Dr. Cannon connects that person with someone in the US that he thinks is either in the region or maybe of best assistance to that person. So I think students or those interested in that advisor service now fill out a short form that gives the person doing the advising a little advance information.
Yeah, thank you for that. As you were saying that, I did include it in the chat, and for those of you listening on the podcast, it's included in the description, or watching the video, it's also included in the description. And that's a fantastic resource. I know I have definitely sent many students that way, especially when there are very specific concerns. I think it's really helpful to have the opportunity to talk to an advisor. And again, this service is for those that don't have an advisor. If you don't
Right.
like your advisor or don't like what they have to say, this is not the service for you. You're likely
No.
to hear very similar feedback.
There are some schools around that don't have a health professions advising office. If the school does have a health professions advising office, then we send the person right back to that office for
Exactly.
assistance.
Yeah. Well, again, thank you so much for joining us today. We have a very lengthy discussion going on today about a very important topic, and that is getting experiences, particularly healthcare experiences during COVID-19. And this has been a huge area that where a lot of students have been affected. So, first off, we're going to walk you through what a typical year would look like, the types of experiences that you might be asking a student to pursue or suggesting that they pursue. And then we'll get into how all of that has changed. So first off, would you mind walking us through? Say a student walked into your office and says, "I don't know what activities I want to obtain as a pre-health student." What advice would you give them?
Well, typically the students have looked at activities um, that are close to where they're located in terms of being at the university, being at home. Um, I suggest that students start with a volunteer experience rather than wanting to jump into shadowing, unless that person has a connection to a physician or someone in the healthcare field already, and to a provider already. One is volunteering gives someone, or gives the facility, the clinic, the hospital, an opportunity to get to know the person so that they see that that student is reliable, has a genuine interest in learning, is polite, able to communicate well with others. And then from that, shadowing can lead into other things as well. Students have ended up with paid positions as a result. The the main thing that we start to with is, why do you want to gain this experience? And the experience should be one, if it's volunteering, it should, I think, be something where the person gives generously of their time. It's not just for what I can get out of it, it's for what one can give. And that's part of demonstrating some of those core competencies that we always talk about, and demonstrating the compassion. And that goes for any of the health professions, really. Empathy, compassion, understanding, the ability to communicate with others. So that's often where we start out. And students that I've known have ended up scribing, have ended up volunteering in a hospital, volunteering at one of the clinics where people go who are underserved in medicine or without insurance. The other thing to keep in mind are summer programs that are offered at schools. I know that Houston participates in the summer health. Well, it used to be SMDEP, summer medical, so now it's SHPEP, I believe.
Yes, that's correct.
And so that's something that um, those who are in their first year can connect with through the AAMC website. I'll pause and let Enrique jump in with something here.
No, I know that that name change has also thrown me for a loop recently as well, which is why I wanted to confirm. But yes, it is a SHPEP program.
Hmm. And schools, other schools have programs too. UCLA Prep has an excellent program. There, Johns Hopkins also has a program. There are programs that are part research and part then opportunities for observing patient contact between patients and physicians that may be doing clinical trials. Those are all things that students can look for and have done in the past. Some of those things, I don't know if we want to jump ahead to how things have changed, or if that's jumping ahead too much or too soon.
But
Uh,
I do want to kind of get to the heart of why these activities are important, and I did
mhm.
want to make a quick note. While we are kind of defaulting to for pre medical or mentioning physicians, shadowing dentists, shadowing veterinarians is exactly the same process. It just happens that their practices are separated by their profession. But just as we're using, shadowing doctors, it is interchangeable for shadowing dentists, shadowing veterinarians. And on the Team DCS application, there's no distinction between shadowing a doctor, shadowing a physician, or shadowing a dentist, or a veterinarian. For veterinary applicants, we do ask for a separation between activities where you are directly supervised by a veterinarian and working with animals. And then there's another section that includes any interactions that you've had with working with animals. But beyond that, everything that we're talking about here is directly applicable to pre-dent, pre-med, and pre-vet students.
Yes, and I might say that the SHPEP program is for dental, medical. They also include pharmacy. They don't include veterinary medicine.
Right.
So if someone's looking for summer programs in that, I know Tufts has a summer program or has had in the past that students have gone to that takes them through a range of experiences. There are also some advisors, pre-health advisors, that have faculty appointments, different places, and who have led trips to Africa um, to treat or see and treat and work with some of the animals
Right.
in a quite different setting. The opportunities for those who are going into veterinary medicine may be a little more extensive than for those who are interested, say, in dentistry, because um, for veterinary medicine, a chance to work with animals, uh, the animals still need to be taken care of in the shelters. They need to be walked, they need to be socialized. So there's an ongoing need still there. Dental, we don't tend to walk in. I've never had anyone when I've gone into the dentist, but there should be there may be some opportunities. Oftentimes people have the best opportunity to connect through their own dentist. I know that in the past, sometimes shadowing in dental has not been the easiest. I've had students make up to 50, 100 phone calls to try and locate an opportunity, but they were persistent and they did.
Thank you. And so now that we've kind of walked through what a typical year would look like in obtaining these experiences, let's talk about what how COVID affected this, because obviously, shadowing a physician is not an opportunity right now due to COVID. Uh, at least not in the same way that it used to be. Or shadowing dentists is definitely not the same experience. And for veterinarians, from my personal experience, they might be the most versatile right now, but even they have a lot of restrictions in place. So, what does it look like right now?
Yes, absolutely. And what makes the situation even more difficult, I think, now is that it's fluid.
Mm.
And it changes from sometimes week to week, month to month, day to day. I know I'm now in a very rural location, and the number of cases has doubled in the last couple of, in other words, there were more cases in the last couple of weeks than there were in the whole time period between March and September. So the restrictions that weren't in place here in May and June are now going into place. So for each person, it's going to depend upon where he or she is located um, as far as opportunities. To a certain extent, that was always the case. I think there are more opportunities in let's put it this way, there are opportunities of a different sort in an urban environment than there are in a rural environment. Um, so I think the most important thing right now that someone can, there's a couple of things actually: creativity and persistence. Those two qualities are going to serve people well as they go along through their educational and professional um, lives. So being able to demonstrate that in terms of how one goes about looking for meaningful activities is going to be important. And there's nothing wrong with sometimes highlighting that it took me a while to find this, but this is what I did. Certainly connecting with other people through the chat that you have going there. Also, there's Aspiring Docs is a place to connect with other people, connecting with other people still through your pre-health advisor, through the opportunities. I know the pre-health advisors have been working really hard to try and make opportunities available. Many of them, yes, are virtual, but again, learning how to take advantage of that. There's certainly applications that people can talk about in terms of the virtual experience, because telemedicine is it was there prior to COVID, and it certainly is part of the whole scenario now. Demonstrating technical competence, the ability to understand what needs to go on in those kinds of meetings is important. It's important to say, okay, I needed to comb my hair before I joined this presentation. I need to make sure that I don't have, several things of, the empty cookie container that I, may have been munching on last night. As one of my friends pointed out, who teaches, and the courses have been online, it's important for people to remember to be fully clothed when they're doing these kinds of meetings in students. So learning the etiquette of virtual encounters may be one of the things, maybe one of the skills that students can work on acquiring, in addition to, again, being creative. One of my good friends who's an advisor said she knows of students who have gathered together and done musical performances outside the nursing home so that the patients can still hear the music but remain, in a safer environment. So that's something else where that's community service, and it brightens the day. Patients in nursing homes are particularly challenged at this point in time. They don't have the visitors, nor do they have the access to activities that made some difference in what could be a pretty dreary life. So, writing letters to patients in nursing homes, maybe setting up, if the patient has or the nursing home has the technical um, ability, setting up a FaceTime. Maybe one meets with a resident once a week for a 15-minute FaceTime or just a visit. But again, the letters, those kinds of things can make a difference for people. And particularly if it's not just a one-time, here, I'm going to, send a Christmas card, but if it's actually building a dialogue between, so they feel like, again, it's not about just you as a student or about the student. It's so they feel like they have a connection.
Yeah, I think that goes right back to the point that you made, where you're you have to show that these activities you're doing from an altruistic point of view, and not just looking to check boxes. Because, I mean, how put yourself in the shoes of that patient. You know, you have been locked in for 8 months now. All of a sudden, you get FaceTime once a week, and then it just stops. You know, that does not show that you're truly engaged for the purpose of helping others who are kind of going through the same human condition. It really has to do with coming at these activities with the intent of helping others through your gifts, as somebody who's connecting with other people, as somebody who is using uh, science to help other people. This is what you're trying to show the admissions committees, and it's not for the purpose of gaining admission into these schools. It's for the purpose of showing that you're truly engaged with wanting to help other people, because that's what you're doing. You're using your gifts in and abilities and knowledge of science and knowledge of the human condition to improve the well-being of others. And I think that fits perfectly into what you just said, Dr. De Olivares. Another point that I wanted to kind of expand on a little bit more, you were talking about virtual etiquette, which is something that we're all brand new in that realm. We did have an article that we wrote about preparing for virtual interviews, and there's a lot of great information here about everything that the schools are looking for virtual interviews and what you need to do on your end to prepare. We're sharing that in the chat right now, but I think that's a great primer for anybody looking to also start doing virtual activities.
Yes.
Because we don't want our popcorn bags or messy spaces to distract from what you're trying to accomplish. So we are sharing that in the group right now.
Popcorn may be okay, but depends on the situation.
Yeah,
I could see if one is meeting with someone in a nursing home and maybe you could, they have popcorn there, you have popcorn there, you could kind of share that
yeah.
experience. But I think the awareness of what one would do if it was an in-person encounter, um, one would want to do similarly if it's going to be a virtual encounter. So,
So kind of in talking about how things have changed now, we have done our part with we've established a kind of a task force of advisors on our end. And these advisors have been informing us of some of the issues that a lot of applicants are seeing. And what we've done is we compiled a survey that we sent out to all of our member institutions through TMDSAS. And we have several responses from our dental or medical and veterinary schools. And I do want to share a few of those. Also adding on to Dr. Delivares' comments about how activities are changing right now, and particularly this response, which came from the Texas Tech Woody L. Hunt School of Dental Medicine. It came from Miss Goldfarb, who has also joined us as part of these courage sessions. The question was, what guidance can we offer students as they seek healthcare experiences during COVID-19? And kind of in the same vein of going out and helping others, she says, I would like to see the ways that students can continue patient exposure interaction with individuals. And then she adds that one response I gave for a group was to put together toothpaste, toothbrush, floss, preventative flyer, games for children to learn about dentistry in English and Spanish, and pass out in the food bank lines. Unfortunately, right now we're at a time where food bank lines are really long, and if people are food insensitive or don't have the ability to obtain food or have difficulty doing so, they are likely to also have the same issues with dental care. And so, putting something like that together, um, you know, that's something that could be really helpful. And all you're doing is, enhancing that situation using your knowledge and your care for the dental field and applying it to a current scenario. And I think that speaks volumes to somebody who's really committed to helping their community as an aspiring dentist. And so I thought that was a really, really key activity that was suggested there. Another one, which was brought up by the Texas Tech School of Medicine up in Lubbock, is that the admissions committees do recognize that there are very limited opportunities for students right now. But they highly encourage that students take advantage of virtual activities that are going on. And this is something that we're doing on the Texas Health Education Service page. Anytime we hear about one of our member institutions hosting a virtual event, we do like to share that information. Sam Houston State has been fantastic about hosting open house events, showing off their new building, their new campus, their inaugural class. The Texas Tech School of Medicine obviously has also been really engaged in that respect. The Texas Tech School of Veterinary Medicine has been great. And so anytime we receive any information that any one of our member institutions are hosting open events like this, we do share those. I highly encourage you all to take advantage of those opportunities because it's the same people that are hosting these events are the ones that are reviewing your applications. And it really shows a commitment not just to improving yourself, to growing professionally in anticipation for, when things get back to some some sense of normality. But it also shows that you're really engaged with that school in particular. And I think that speaks volumes to, when you're reading applications and you see a name that commonly pops up in these activities, I think it really allows you a unique opportunity. So really take advantage of those opportunities that the schools are providing and keep engaged with those. Another question that we'd asked was about the virtual healthcare experiences, because these are particularly difficult right now to kind of wrap our heads around. And a huge shout out to Miss Pam McNulty up at the SMU campus up in Dallas. And she was key in sharing how a lot of students are having difficulty in figuring out healthcare experiences that are virtual, and worried that some healthcare experiences that are virtual may not be sufficient for an application. As we're going at it right now, we're very close to coming to a full year. So somebody who was a sophomore when everything went into this virtual space, who may be applying next year, the key time during which you would be doing all of these activities has been completely altered due to COVID. And so the question here is whether virtual experiences will be sufficient. And uh, almost all of the schools do say that they will accept virtual shadowing experiences, virtual healthcare experiences, virtual scribing experiences, especially looking at it through the balanced lens of, this is still a temporary situation. So rather than just sitting back and waiting for everything to get back to normal, you're taking advantage of these virtual spaces, virtual experiences, and then when things a lot, or when the situations improve and you're able to do additional experiences in person, you're able to complement those two successfully. So at this time, what we're looking at is kind of a balance that you're going to end up making when you do submit your application. Is that, for this year or 18 months, you are doing virtual experiences. You're doing virtual shadowing, virtual volunteer, and we can talk quite extensively about all these ideas that Dr. De Olivares and I have had. And then once we get back to some sense of normalcy, you are able to go in and get shadowing experiences. And so what that shows is that even in the middle of a global pandemic, you are still engaged with wanting to become a dentist, or wanting to become a veterinarian or a physician. And so it's important for you to find something that helps to continue to push you forward. And hopefully that's the main theme that you're picking up during these courage sessions, is that yes, a lot of stuff right now is kind of on pause. A lot of our lives are on pause, but the ultimate takeaway is that you have to continue to push toward your goals, because we are still very much in need for healthcare professionals. And even more so, we're in need of healthcare professionals who are willing to, as Dr. De Olivares said, to have that creativity and have that persistence to keep pushing forward.
I was going to just interject a note here. Part of what shadowing is about, at least part of it, is understanding more about the lifestyle of the person one shadowing. I looked a lot for books on dentistry and that have been written by dentists. There's not a lot out there. Um, so maybe someone will take that as an opportunity, but it's not just virtual. We can go back to and reading, and I have found a lot of students in the past have enjoyed reading. There are wonderful memoirs written, particularly it seems by physicians. Again, if we go back to All Things Great and Small, or James Herriot for veterinary medicine, which paints a little different picture of what it's like now than it was then. But there are wonderful physician memoirs out there. Dr. Abraham Verghese wrote My Own Country, and he was just starting his really professional career in a time that AIDS was just really surfacing in people's awareness, as well as, um, you know, the population. And he was an infectious disease physician. He talks about that and what he encountered. Again, there's wonderful memoirs. So reading and gaining some understanding through what physicians have shared already is another way of not doing shadowing, and it's not quite virtual, but it in some senses may strike deeper at times.
Yeah, and kind of adding to that point, another one of the responses that we got from our member institutions is actually from Dr. Kellaway. And she shared, obviously that we live in a great age where information is available to us at the click of a mouse. And so she and definitely several of the schools have also suggested about, pulling up virtual conferences, videos where healthcare professionals are talking about their experiences, where you could actually go in and do, you could pull up a YouTube video about different systems of the body. You could pull up YouTube videos about how different chemicals affect different people, different animals, perhaps. There are just so many resources available that can keep you engaged rather than being in a holding pattern. The worst thing you could do for yourself right now is to sit back and wait, because that's not going to help you in any way, shape, or form. And I can guarantee you that for the foreseeable future, one of the questions during your interviews will allude to what you did during the pandemic to help you continue pursuing your journey. And I think that's something that's really uh, kind of a takeaway that I've taken from this situation, is that we are all going through this. This is something that is an experience, the same experience, if not very similar experiences to what I'm seeing right now, Dr. Delivaris is seeing as well. I live in the edge of a rural / suburban community, and so I've seen those similar struggles on my end. And I can definitely, neighbors just down the road are having very different uh, particular individual experiences, but it's all coming down to this. And so this is sure to be a question that's going to come up. And so it is incumbent on you to figure out opportunities. And we're not telling you to go out and put yourself in danger or find opportunities where you might not be comfortable. We're asking you to find within your comfort level, what activities can you engage in to really go out and show that you're committed to this pathway and that you're committed to using your gifts uh, to help other people. And we've shared several examples here throughout the current sessions. We've shared many more examples about that as well. But I think the key takeaway here is, don't sit idly by. Keep pushing forward toward this goal.
You had mentioned when we were talking before a little about this session, manual dexterity. I think that was a suggestion from one of the dental schools.
Yes.
And there's all kinds of things that one can do to demonstrate that. You might make some kind of jewelry making or something like that, that then you could donate to a place, or use as gifts for someone. There are little itty bitty Lego kind of things that I got somewhere one time that can be put together in all kinds of different designs. And at some point, we all will probably be in person socializing more. But one of the things for all the health professions is that interaction with others. So if it has to be virtual right now, get a group of your friends and do a Zoom meeting or something. And while you're doing that, put together something and see who, has problems putting that together. It's great for dental, but or have a contest with some of your friends. Get a piece of chalk and you can carve a tooth. Not that they do that anymore during interviews for the most part, but they used to. But carve a tooth, and then you give a prize out for the best one among, a peer group, maybe your pre-dental association. Um, that also, though, manual dexterity is important in terms of medicine and veterinary medicine as well. So there's different things. I don't know if you want to carve a tooth or medical, but it could be fun. You could carve something else.
Yeah.
Those kinds of things. And then when you're doing an application or writing your personal statement, your leisure time activities are not solo kinds of things too. I think that's important for all of us to remember during this time, is that we don't have to do this solo.
Mhm.
If if your peers are dispersed and it's difficult to find a peer group because maybe you've recently moved like I have or something, or I'm in a different location, then connect with your friends in other ways, or get a hold of one of us and see if we can't help you, facilitate some connections.
Mhm.
I think it's important, though, that you don't have to do this solo, and that you don't do it that way.
And I think that's a great opportunity for me to pitch a welcome to anybody who would be interested. Maybe you are in a community where you are completely isolated from anybody else who's pursuing the same pathway. We would very much love to have you in our online communities, the TMDSAS Hub, which is open to any and all applicants. And then, of course, we have the TMDSAS Non Traditionals group, which gives you the opportunity to talk to other non traditional students. And the reason why we have those two separate is because obviously non traditional students face some very unique challenges, particularly around, you know, obtaining support from their schools, figuring out a way to go back to school. Uh, and so these are really fantastic communities where you can, I'm sure you could drop in and say, hey, does anybody want to do, visual challenge where we use manual dexterity uh, in some way? We're sure to find lots of people there. We have about 2,500 members in each one of those groups, and they're all so helpful. It's a safe space for you to come in and ask questions with no judgment. Everybody comes in on the same place and is ready to help.
Hmm.
Uh, and kind of back to the topic of manual dexterity, we did talk about this when we had the session with Dr. Malone and Dr. Miller.
Hmm.
And particularly, what we mean by manual dexterity is just, obviously in the setting of dentistry, you have to do a lot of work within a very small space within a person's mouth, oftentimes. But when we're talking about manual dexterity within medicine, within veterinary medicine, you know, pull up a video of how suturing works and how you never actually touch the needle. You're actually using tools to make that happen. Take a look at how um, dermatologists actually suture in comparison to how fine their skills are, or a surgeon how fine their skills are. And take a look at some of those, and you'll be quite impressed, and you'll see why it's important for you to start kind of working with those. Another big thing that Dr. De Olivares and I have seen on several of our tours of the schools is so many things are robotic now. It's incredible at how often we see a whole rig set up where it kind of looks like somebody's using Oculus with the little joysticks and they're actually performing different surgical tasks. Dr. De Olivares, did I lose you? I think we did. She did mention that she's in a very rural setting. We may have lost her for a second, but she'll be back on in just a second. Another issue that we definitely wanted to talk about today has to do with letters of evaluation. Now, oftentimes, what would typically happen is that for your letters of evaluation, you would engage in different activities. And throughout these activities, you're talking to physicians, you're talking to professors, and you're really engaged with them. And so the reason why the schools are looking for these letters of evaluation is during your application, you can talk a great big game about how awesome you are, all the great experiences that you've gained. But the letter of evaluation offers the schools a third person perspective on how you engage with those activities and how well you'll be able to fit in within the profession to which you're applying. And so when we're talking about virtual experiences, it's very difficult to kind of make the case that somebody who's working with you in a virtual setting would be able to support you to write these letters. And I think what's important here is that we're talking about the intent of those letters early on with the people that we're shadowing. Hi, Dr. De Vars. Thank you for
I
joining.
am back. Again, that rural kind of.
Yep. So we're talking about letters of evaluation right now, and how we encourage students to approach evaluators early on in such a manner and in a very direct manner to say, I'm here because I would really like to have you as an evaluator, letting them know months in advance from when you actually intend to ask them for that letter so you can actually build that relationship with them. And so we're talking now about what that looks like in a virtual setting. Um, and so when that actually the same advice would apply to virtual settings. If you currently are taking an online class or a class that is online, rather, you still have access to your professor via office hours. You have access to your professors via email, and many times they might still even use telephone, and you can call them. It's important for you to go out and find opportunities to engage with them and be very clear upfront and letting them know I would very much like for you to be an evaluator and I would like to schedule some check-in times from now until then where I will let you know what my progress looks like and you're able to see my progression so that you can write a more well-rounded letter of evaluation. And for those of you that are kind of like not quite sure what these letters look like, we will definitely be providing a workshop for any evaluators and for you to help your evaluators discuss what it is that the schools are looking for. But what's important right now at this moment is that you start approaching these professors. We're around the time of midterms right now for the fall semester, and this is a key time. Do amazingly on these midterms, of course, but also having that piece of information, your professors are going to be much more likely to be open to engaging with you in that manner.
Yes, and you may end up um, not knowing exactly. I mean, if you're starting out as a first year student or in your first classes, not knowing exactly who you may want to ask in another couple of years, but building a relationship now with some professors that you may find have a research interest you'd like to learn more about. Uh, then that can come in very handy as you move along later. And you've already got something where you've done, had some communication. And then when you say, would you be willing to write me a letter of recommendation when that comes time, or a letter of evaluation? That makes that conversation go a little bit more smoothly, a little bit easier. So look at establishing those connections when you first start out your educational journey.
And on that same topic, with engaging with your health professions advisor, I think you have some really unique insights there. What advice can you offer students about engaging with their advisor?
Well,
They pull
I've
out
been,
the list.
yeah, actually, Dr. Beck and I wrote the adventures of Xander and we called it Xan and T
Yeah.
for in the Apply magazine, where we talked about how to potentially engage with one's health professions advisor. I think going in and just making that initial visit, when I have written letters of evaluation, written the committee letter, and am able to say, someone came in the summer prior to enrolling in classes, or their first semester they came in, just to introduce themselves, say hello, find out what maybe where the health professions office was located. At this point, some health professions advisors are in their offices on some campuses and some are not. So it just really depends on what each campus situation is, whether you need to find the physical location or the virtual location. But say hello, and then you can just initiate that conversation and then check in regularly. It's also important to read what is written as instructions for different things. Many of the schools that will have a committee letter have deadlines for participating in that committee letter process. And paying attention to what those deadlines are and what's required for that committee letter process will help both you and the advisor develop that working relationship that's going to be, ultimately the most benefit to you.
And that's the
Those are
H.
just a couple. We could go a little, further.
We will. And that's the HPAC or committee letters that we're mentioning.
Correct.
As you all will recall, there are several opportunities for you to submit letters to TMDSAS. You can submit for medical and dental applicants. You're able to submit health professions packet, which would either collect several letters or actually host an interview and write a letter on behalf of a committee. And then you are able to submit an additional letter on top of that. Or you submit 3 individual letters of evaluation and you're able to submit an additional optional letter if you would like. For our veterinary applicants, we actually have evaluation forms, which is an actual uh, kind of like a survey type form that you would send over to your evaluators. There's no letter of evaluation for veterinary school applicants, but there's a slightly different process, but it's very intuitive, I think, for evaluators there.
It's
But
actually fun. Having done a couple of the evaluations for schools of veterinary medicine, it's a little bit, or for the A&M and now the School of Veterinary Medicine there at Texas Tech, it's a little like a test for the evaluators. You get to fill in, yes and no, and then you have short answer
yeah,
that you fill in as well.
which is why it's so important for the students to take the action beforehand to really know that their evaluators know them well.
And it's important for somebody to have, for the veterinary medicine, it is important to have a veterinarian
Hmm.
generally, yes.
So back to the committee letters discussion. I know you have a lot more to say about the process and how students can prepare. Um, Not every school will offer a committee letter, and I think it's important to note that the professional schools have not expressed that one is better than the other or
Mhm.
more helpful than the other in understanding those applicants. But I think it is important to note that the professional schools, do know which schools offer health HPAC committee letters. And in the event that somebody doesn't submit an committee letter, one of the questions that is asked is like, why wouldn't they? Are they not engaged with their advisor? Are they not? Did they not meet the deadline that was set by the advising office? And so it doesn't necessarily impact you in one way or another, but I do want to let you all know that this is one of the questions that an admissions committee will ask because it's very well known which schools have uh, advisors that will submit an HPAC or committee letter.
And I guess it's okay to say, yes, I have received phone calls from the schools that said, we noticed so and so did not have a committee letter. Can you tell us why that person did not?
And it's just, I mean, again, it's
And that
not.
doesn't mean that person will or will not be accepted,
Yeah.
but it's part of understanding the it's part of a holistic review of the applicant, really.
Yeah. And it's along the lines of what we talk about in several of our online communities. An example is often, I didn't do so well on my MCAT. How can I continue to show that I am academically capable? And so it's like you have the one red flag or uh, thing that kind of stands out, like the MCAT, but then you have, excellent letters of evaluation from a professor that talks about how great you did in an upper division science course. You have an excellent GPA in the sciences. You have uh, excellent support from a physician in that area. I think those help offset the concern about a lower MCAT score. And you can see that in the statistics of our MCAT uh, against GPA scores. Not to say that the MCAT isn't important and that you should do very, very well on it to be more competitive, but it's kind of like it's a balance game, which is why there isn't necessarily a set checklist of things or activities that you should complete. So, in the event where a committee letter kind of raises concern, maybe where evaluation letters are not as strong as they could have been, and then finding out that the student didn't pursue a committee letter or even engage with a health professions advisor at all paints a better picture of what the applicant did, and that tells us, well, that tells the admissions committee rather, that the student may not have pursued the steps that were required of them to produce a competitive application. And then with that information could reveal some other areas within the application that may be concerning. Uh, But again, I do have to reemphasize that having a committee letter or submitting individual letters of evaluation, there is no preference to one or the other. It's just the question of how well that applicant engaged with their health professions advisor. Remember that this is a very tight knit community here in Texas, with TMDSAS at the helm, and having all of our public uh, dental, medical, and veterinary schools in place. Uh, all of these folks, I mean, we have calls several times a month. We send emails to each other. We pick up the phone and call each other. We text each other. There's a lot of communication that happens, and that doesn't just take place within the TMDCA schools. It also takes place with all of our health professions advisors. And so, when I have a professional relationship with someone like Dr. De Olivares, and I see an applicant coming, next time I see her at a conference, I could say, "Hey, I saw this applicant. I thought it was really interesting that they had blah blah blah." Same thing when concerns come up. It's like, I'm a little concerned about this applicant in comparison to the other applicants that were sent in. What's going on? And that's all part of the holistic review process and might not be necessarily things that applicants might see on their end, but is definitely something that happens.
Well, one thing I would say I spent before I was at the University of Texas at Dallas, I was at Southern Methodist University. And during both of those, I guess it's about 20 plus some odd years, 25 years, I don't know. Anyway, almost without fail, the interaction with the health professions advisor, both of those places had committee letters. And going through the committee process and going through and having a committee letter was helpful for the applicant. One thing that is often incorporated in that committee letter process are practice interviews. And I call them that because they do present that opportunity to practice, but they're also evaluative in that comments from the interviews are placed into that committee letter at a number of different schools, thus giving more weight to the interview and making it, seem a little more nerve wracking, which is good practice. So students have found that to be extremely valuable in terms of the preparation that they have going into the medicals and dental. Those are available for both medical and dental
Mhm.
students. And at some schools, they're available for students that are going into health professions other than medical and dental as well.
Yeah.
I think we're probably getting close to time here.
Yes, we are actually. I did want to make time for that excellent quote that you shared from Dr. Jones, because I think it's
Oh,
important to
yes.
share that right
Yes, Dr. Jones, Dr. David Jones was, when I started as chair of the committee and moved from advising first and second year pre-health students to advising those who were going through the application process as well. Dr. Jones was one of the first people who visited me in my office. And at that time, he was there in San Antonio and at medical school. And we were talking, and JAMP was just starting. So he was talking to me about a potential for JAMP applicants. And I learned so much from him over the years. And I remember him telling students at a AED meeting, when they ask about, well, what should I do? What do you think is significant in terms of activities? And he said, if it's meaningful for you, it will be meaningful for us. And so I have quoted him on that numerous times. There'll be students out there who will go, yeah, I remember her saying that. But I've quoted him numerous times because it's a reminder to stop and think about what has meaning for you and why it has meaning.
now. Right. And I think that's so powerful, especially, there are so many prescriptive aspects of the application that it seems that it's a checklist, but in reality, it it's not. And the schools aren't looking for the cookie cutter. They're looking for people who are truly engaged and truly connected to their purpose of wanting to pursue this career. And I think that truly shows up in an application, and it is extremely apparent in the interview settings, because when you're sitting in an interview and somebody is just as passionate about talking to you about their leisure activity as they are about this career path, it's very clear. Uh, I've interviewed JAMP students in the past, and there's a quote that they drop from The Office, and I'm able to pick up on it, and then we talk about The Office, and then we start talking about what they've done to prepare and what this career path means for them, and they are just as passionate as they were when talking about The Office. That tells me so many things about how connected they are with this pathway and how passionate they are in pursuing it. And I think that speaks volumes. Well, we've reached the end of today's courage session, and I know that Dr. Beck prepped you for your sign off, and I'd like to offer you the opportunity to share your words of wisdom and courage to our students.
Well, actually, these are not my words. Someone, Maya Angelou, who was a national poet, and when she passed away, the Washington Post had a quote from her. I thought it was very apropos. It says, "Courage is the most important of all virtues, because without courage, you cannot practice any of the other virtues consistently." And so she was someone who showed courage throughout her life. And I think someone who we can well emulate.
And that's so powerful, and it perfectly sums up everything that we've discussed today. It takes courage, but it's going to be worth it. This is what you want to do. Hopefully, we've given you some guidelines to help you accomplish that. And again, we are all available to help you at TMDSAS and the Texas Health Education Service. Uh, Join the Facebook groups that we have to continue the conversation. There are many other people out there who are in the same boat. Uh, the key takeaway for today is definitely to recognize that everybody's in the same situation. And the schools are exercising a level of flexibility that was unforeseen in previous application cycles in terms of activities, in terms of everything that's going on. But what's important is that you continue to say, engage with the process. You find activities that are meaningful to you. And as you just mentioned, you find the courage to exercise all of the virtues and all of these strengths that you have, because we all need them right now. Dr. De Olivares, thank you so much for joining us today. You just got a big shout out from Pam McNulty.
Hey.
Just let her know I miss her. It's great to watch the session live. Hope she knows how busy I am, and look forward to watching the video. Thanks for watching.
I'm honored. I'm honored to have been asked to do this, and thank you so much.
Absolutely. And on behalf of Dr. De Olivares, Texas Health Education Service, and TMDSAS, we wish all of our applicants all the best of luck, and keep at it because it's going to be worth it.
All right.
Thank you.
Bye-bye now.